Hi, I'm Vicky Bazanos, a nurse practitioner student at Brandman University. I'm here to perform my head to toe assessment. This is my patient, Lucy. We're in a private room, comfortable exam table, patient is comfortable. Before I arrived, the medical assistant did a full set of vitals on the patient. All were within normal limits. We also did a visual acuity check. Corrected vision for the patient is 20/20. While I do my assessment, I'm gonna listen to Lucy's speech and her answers, assess for any potential cognitive, neurologic, or psychiatric issues. Hi Lucy, how are you doing today?
I'm doing well. How are you?
Good, good. Thanks for coming in. We appreciate you being a patient here. Since you are a brand new patient here, we're going to do a really thorough head to toe assessment because we want to have a good baseline in case any issues come up in the future. Okay. We grab some hand sanitizer here before we start. First, I'm going to do just a sort of general inspection, just look you over. I see that your skin is clean, dry, and intact. I don't see any bruises, any masses, any pulsations. I don't see any lesions anywhere. Have you had any problems with your skin in the past?
No.
Okay. Let me take a look at your hands here. Okay. So nails are well groomed. No clubbing noted. Cap refill is less than 3 seconds. Okay. Let me take a look at your feet. Okay. Again, skin is warm, dry, and intact. Okay. Cap refill less than 3 seconds. No clubbing. Okay. Patient's skin color is appropriate for ethnicity. She is well groomed, appears well nourished, well kept. Clothes are clean. So what we're going to do is we're going to start at the top, kind of work our way down. Okay. I'm going to step over here. I'm just going to palpate your scalp. Let me know if you have any tenderness, if anything hurts.
No.
Okay. So not feeling any lumps, not feeling any masses. Do a quick look here at your scalp. I'm not seeing any lesions. Okay, it's good that you don't have any tenderness. Hair is evenly distributed. I'm not seeing any areas with hair loss. So we're gonna move to your eyes. Okay, I'll have you take your glasses off for me for just a sec. Okay, just looking at your pupils, your iris, your sclera. Everything looks good. Pupils are round, iris is round, sclera is white. Go ahead and look up at the ceiling for me. Just going to check your conjunctiva, nice and pink. I don't see any swelling, any masses, no drainage or anything like that. Okay, let me palpate right here. It's your lacrimal duct. No tenderness or anything. Okay.
No.
And no, there's no drainage when I do that. Nothing comes back up. So you can put your glasses back on for a minute. I'm going to have you take a look at this. Just look right at the tip here. I'm going to move it around. Don't move your head, just move your eyes, okay? Okay, looks good. And in towards your nose. Okay, very good. So what we're checking there is cranial nerves. We're checking to make sure that that your eyes move in all the appropriate directions. Cranial nerves 3, 4, and 6 are responsible for eye movement. I also checked accommodation and convergence. Your eyes are able to focus on something close, and your pupils constrict just a little bit when you do that, so accommodation is good. Now I'm going to shine a little light in your eye. Let me use this one here so I can check your red reflex at the same time. Okay, look over my shoulder, don't look at the light because it's kind of obnoxious. There we go, good red reflex in both eyes. Okay, again, keep looking over my shoulder. This is just to see if your pupils constrict. Okay. There we go, and one more time. Let's see what the opposite pupil does. Okay, fantastic. So your pupils start out about 5 millimeters, constrict to about 3. That's perfectly normal, and they react appropriately to light. I'm going to move on to your ears. We're going to do some hearing tests. Okay, this is cranial nerve 8 to check your hearing. You know what? I forgot an eye test. I am so sorry. I'm going to put my hands kind of around your back. You let me know when you can see them wiggling, okay?
Yes. Yes.
Okay, one more time. Sorry,
Yes.
I have to get a little close there.
No worries.
When we check your vision, we're also checking, that's cranial nerve 2. If you're able to see, we know cranial nerve 2 is intact. So for your hearing, cranial nerve 8, I'm going to whisper some words. You just repeat them back to me, okay?
Okay.
7, 3, 9.
7, 3, 9.
Okay, that would be repeated on the other ear as well. Okay. Another hearing test, this is called the Weber test. I have to kind of make you look like a unicorn. I'm going to strike this on my hand and then put it on your head. You're going to tell me which ear, one or both, that you hear the sound in, okay?
Both.
Okay, fantastic. Next test with this is called the Rina test. I'm going to strike it again and put it on this little bone back here behind your ear. You tell me when you don't hear the vibration anymore, okay?
Okay.
You hear it now?
Yes.
Let me know when it goes away.
Okay.
A little too hard that time, sorry. So that's just checking air conduction versus bone conduction, and yours is appropriate. Air is longer than bone. That's what we like to see, okay? Let me move on to your nose now. Sorry, I have to keep having you lift up your glasses. I'm going to palpate your sinuses here real quick, okay? Let me know if you have any tenderness, any discomfort.
No.
Here. Any tenderness,
No.
discomfort? No. Okay. Palpate the bridge of your nose here. It's midline, no tenderness, no discomfort with that. Okay, I don't see any obvious masses or lesions. Check your ears too. No tenderness?
No.
Okay, sounds good. Let me have you lock one of your nostrils. Deep breath in, and the other side. Okay. I just have to make sure your nostrils are patent because I'm going to check your sense of smell. Okay. So you pick, block one of them. I'm going to put something under your nose. When I tell you, take a deep breath. Let me know what you smell. Okay. Go ahead.
Cinnamon.
All right. And block the other side. Close your eyes. Okay. And deep breath.
Rubbing alcohol.
Okay. I tried to keep it kind of far away. Okay. So your sense of smell is intact. That's cranial nerve 1. Let's I'll tell you what. We'll take a look inside your ear real quick, and inside your nose. Then we'll look at the inside of your mouth. All right. Okay. So I'm gonna pull back. Let me go to the other side. Okay. I'm gonna pull back on your ear. I'm going to hold it here so I don't go too deep inside your ear. Okay. Okay, so tympanic membrane is visualized. Cone of light is visualized. Tympanic membrane is pearly gray. I don't see any fluid behind it. I don't see any redness or swelling. I don't see any exudate in your ear. Have you had any problems with your ears at all?
No.
Okay. Again, would be repeated on both ears. Let me take a look inside your nose. Okay, just lean back. Okay. So septum is midline. Mucosa is pink and intact, nice and moist. I can visualize the terminates. Again, no masses, no lesions. Any nose problems?
No.
Okay. I won't put this in your mouth. I just need you to open your mouth for me so that I can look inside. I'm going to use a tongue depressor just so I can see to the back of your throat, okay? Open up, nice and wide. Say ah.
Ah.
Oh.
There we go. Ah.
All right. And I'm just going to look around in your mouth, just look at your mucosa, check out your teeth. Can I see under your tongue? All right. All right. No masses, no lesions. No dental caries noted. Your uvula, the back of your mouth, when I had you say ah, it lifted up symmetrically. That's one of our tests for cranial nerve 9, so we know that's intact. Excuse me. I'm going to have you make a couple faces for me because we're going to continue assessing cranial nerves, okay? First, I'm going to have you bite down real hard, and I'm going to try to open your jaw, okay? So bite down real hard, okay? And, okay, very good. Okay, close your eyes for me. Okay, don't let me open them. All right. Lift up your eyebrows, okay? Puff out your cheeks. And big smile. All right. Lean your head against my hand, okay? Turn against my hand. And shrug your shoulders. Okay. And stick out your tongue, side to side. Okay. So we've got cranial nerve 11 with the lifting and the turning of the head. We've got cranial nerve 5 with all of the faces. One last thing I'm going to do, some of your cranial nerves are sensory and motor. So we're going to see if you can, if you have proper sensation in the skin on your face, okay? So close your eyes for me. Tell me when you feel this.
Yes. 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 Yes.
Okay, very good. So sensation is intact. For your facial nerve, and trigeminal nerve, 5 and 7. That's with the faces and everything. I may have already said this. I apologize. I'm not going to check your gag reflex today. That's another test that we do for cranial nerve 9. But you're speaking while you're swallowing. So I'm going to take it for granted that your gag reflex is intact. Okay, let me move on to your neck now. I don't see any obvious masses or lesions. I don't see any unusual pulsations. Trachea is midline. Okay, let me move around the back here. I'm just going to palpate for your thyroid. Okay, put your chin on your chest. Okay, swallow for me. Okay. I don't feel any swelling. I don't feel any masses there. Another thing that we're going to do is palpate for any inflamed or enlarged lymph nodes, okay? So 10 different spots. We've got pre-auricular and post-auricular, okay, occipital, tonsillar, submandibular, submental. Okay. We've got the superficial cervical, we've got posterior cervical. I have to pinch a little bit because the deep cervical are actually underneath a muscle. Okay, I'm gonna have you shrug your shoulders so I can kind of see your clavicle a little bit. So supraclavicular. I'm not feeling any inflamed lymph nodes anywhere. Now we're gonna do a little bit of range of motion. You can put your chin down to your chest and then look up at the ceiling. Okay, ear to shoulder, and other side. Look to the right, look to the left, and one big head roll. Fantastic. Any pain, any tenderness, discomfort? All right, sounds good. I'm gonna listen to your lungs now. We're gonna do a lung assessment. It involves a few different things. I'm gonna listen. I'm gonna have you say some words for me so I can feel vibration in your back. And you're gonna feel me tapping on your back a little bit too, okay? Move your hair just a little bit. Okay, so just general skin inspection from what I can see. No masses, no lesions. A few little nevi, nothing suspicious for skin cancer or anything. Can you do me a favor, say the word 99?
99, 99, 99, 99, 99.
Okay, and that's just checking to make sure the vibration is equal on both sides, all lung fields. Tells us if there's any mass or consolidation in there, if the vibration is off. Okay, now you're gonna feel me percussing, so I'm just gonna tap like this down your back, okay? Okay, so lungs are resonant, sounds are equal bilaterally. Again, that's just to check for any masses or consolidation. Next, I'm going to check for where your diaphragm is and how well it moves when you breathe, okay? So take a deep breath, but blow it all the way out. Okay, so we hear the change in the sound right about here. Take a big deep breath and hold it in. Okay, and now we don't hear the sound change till down here. So your diaphragm is moving appropriately when you take a deep breath. Okay, next you're going to feel my hands on your back. When I ask you to take a deep breath, I'm just checking to see if my hands move out, to see if your chest expands appropriately, okay? So big deep breath. And let it out. Okay, so chest expansion, excursion is symmetrical. Now I'm going to take a listen to your lungs. Okay, big deep breath. And out. In. And out. Okay. The auscultation assessment would be performed for a full breath cycle in each of the following areas. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. Okay. You feeling okay?
Yes.
I know sometimes we can get a little dizzy when I make it breathe a little too much. Go ahead and face me. Okay. I'm going to continue the pulmonary assessment on the front side, okay? So any tenderness anywhere?
No.
Okay. Again, skin is clear, few additional nevi, but no masses, no lesions, nothing unusual noted. Can you say 99 for me?
99, 99, 99.
Okay, and a little percussion. All right, sounds good, just like on the back. Go ahead and lay down. I'm going to listen to you while you're laying down because I'm also going to listen to your heart too. Okay, deep breath for me. Let it out. And deep breath. And out. Okay. I would listen in each of the following places for a full breath cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Okay. Any trouble breathing?
No.
Have you had any breathing problems in the past?
No.
Okay. Patient's breathing is regular and unlabored, no apparent respiratory distress. I'm going to listen to your heart. Okay. We're going to listen to 5 different spots. That kind of tells us what's going on in different parts of your heart, okay? So first I'm going to listen in the aortic area. And pulmonic. Okay, and Erb's point. Okay, pardon me, tricuspid. Mitral. All right. That would be repeated also on those same 5 areas with the bell of the stethoscope. Okay. We're going to check some pulses here, okay? First thing I'm going to check is, it's called the PMI. It's the point of maximal impulse. I'm going to have you lay just a little bit on your left side. Okay. If you can put this arm up just a touch. Okay. I'm going to put my hand here. Okay, there we go, right about there, right where we would expect it to be. That tells us if your heart is positioned appropriately. Okay, I'm going to feel your carotid artery. Okay. Brachial. Just feeling for your pulses. Radial. Ulnar. Okay, femoral, I would assess here. Go ahead and relax your leg. Let me do the work here. I'm going to feel for your popliteal artery. This one's a little bit harder to find. Okay. Posterior tibial and dorsalis pedis. Okay. That would be checked on both sides as well. Okay. Since I have the stethoscope out, I'm going to listen for what we call bruits. We're just going to check to make sure you have non-turbulent blood flow through your large vessels. Okay, so listen to carotid first. Okay, that sounds good. Now lift your shirt here just a little bit. Okay, abdominal aorta. Sorry, I shifted it a little bit. There we go. Okay, renal. And iliac. I would also assess femoral. That's going to be deferred for now. Okay. I see that your abdomen is skin is clean, dry, and intact. No masses, no obvious pulsations. Have you had any abdominal problems?
No.
Okay. I'm going to just listen to your bowel sounds. Okay. Okay. Bowel sounds present in all 4 quadrants. I'm going to do a little bit of light palpation, just to see if you have any tenderness anywhere before I do any deep palpation. Before I do that, though, I need to ask: Are you pregnant, or might you be pregnant? Okay. I don't want to push too hard if there's anything sensitive. Okay. Any tenderness?
No discomfort.
Okay. So no discomfort on light palpation. We're going to do a little bit deeper this time. Okay. Any tenderness, pain? Okay. All right. No discomfort noted with deep palpation. Okay. While I'm on this side, I'm going to check for your spleen. Okay. So I'm going to reach underneath your rib cage. It feels a little uncomfortable, but I'll have you take a deep breath and then breathe way, way out. Okay. So breathe out. Okay. And one more big deep breath. Okay. Alright, so I can't feel your spleen. That's good. We don't want to feel your spleen. That would mean that it's enlarged. Okay. You're going to do the same thing on this side, trying to feel for your liver. Okay. Okay, so a deep breath. And blow it out. Okay, big deep breath one more time. Okay, so I feel a little bit of your liver here, which is totally normal. The liver's a lot bigger than the spleen, so we feel that one. We don't feel the spleen usually. Any tenderness when I do that?
No.
Okay. And I noticed you took a nice deep breath. It didn't indicate any pain. You didn't halt your breathing or anything, so that's good. Okay, I'm gonna read. You can lift.
Oh, it's okay.
Okay, I'm just gonna feel for your kidneys back here. Any pain when I do this? Any
No.
tenderness? Okay. And this side. Pain or tenderness?
No.
Okay. Fantastic. All right. While you're laying down, we're going to do some range of motion with your hip just because it's a little bit easier while you're laying down, okay? So let's lift your leg here, okay? And lift it out here and then in towards the center. Any
No.
pain or tenderness in that? Okay. We'll check the other side as well. Up. Okay. Abduct. Abduct. Pain or tenderness?
No.
Okay. Fantastic. I'm going to have you take this heel, put it up on this shin, this knee, and just slide it down the front of the shin, okay? Okay, and the other side. Okay, how fast can you do that? All right, that's good, sorry. Okay, I'll have you sit up. We'll go ahead and move on to the next thing. This away here. You feeling okay so far? Okay, I know sometimes when we have you move around a little bit, things can get a little dizzy, but if you're feeling okay, we'll move on to the next part. We're gonna do some more range of motion. Okay. So we already did your neck and we just did your hips. We're gonna check your shoulders now, okay? So just big circles for me. Up and down, and then back and forward. Okay. Put your arms out straight. Okay, lift and push down. Very good. Okay, elbows up and up. Okay, pull and push. Fantastic. Wrists, can you do some circles for me? Okay. Up and down, and then put your hands out flat. Move your thumbs in and your pinkies out. Okay. Wiggle your fingers for me. And a nice tight squeeze. Fantastic. Looks good. Okay. Lift your knees for me. Okay. And back down. Pain or tenderness?
No.
Okay. Push and pull. Okay. Lift your feet up towards the ceiling and push down. Okay. Circles with your ankles. Okay. Wiggle your toes. All right. Looks good. We're going to do some sensation tests here as well. Okay. The first thing we're going to do is a vibration sensation. Okay. I'm going to use this little tuning fork again. I'm going to put it just on your bone, on your wrists and your ankles, or your wrists and your toes. You let me know when the vibration stops. Okay. So close your eyes or look up at the ceiling, something like that. Okay.
Okay. Okay. Okay. Okay.
Okay, fantastic. Now we're going to check your sharp versus dull or soft sensation, okay? So this is sharp, and this is soft. Okay, close your eyes, tell me what you feel when you feel it.
Sharp. Sharp. Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Okay, fantastic. Okay, we're going to do some reflex tests. Okay, we have a few in the arm to do and a few in the leg to do. Okay, so I'll have you rest your arm on mine like this. Okay, and feel for your tendon here. Okay, so I'm going to hit my thumb. And nice and relaxed. Okay, watch for just a little twitch. There we go. Okay. Go ahead and lay your hand down here. Again, I'm just going to tap my thumb, see if your thumb twitches. Okay, a little bit. Okay, this one, I'm going to support your arm. Okay, just nice and relaxed. Okay. This one's kind of annoying because I have to hit like that little funny bone area, but okay, nice and relaxed. Okay, there's a little twitch there. Okay. Next, we're going to check your patellar tendon. I'm going to scoot this up just a little bit. Okay. All right, there we go. The other two we'll check in a little bit when you stand up, okay? Do you have any questions for me so far? Are we doing okay?
No. Yeah, doing great.
Doing great, okay. Go ahead and stand up here for me. We're gonna do some walking and a few more range of motion tests. Let me do those reflexes so we can get this little stool out of the way. That way you have a little more room to walk. Okay? So, with your knee up there, foot nice and relaxed. Okay, we're just gonna check your Achilles reflex. Fantastic. Okay, I'm just gonna scrape the bottom of your foot. Sorry if it tickles. Okay, but your toes scrunch down, which is what we're looking for. Okay, we'll scoot this over. I'm gonna have you do some walking for me. So right along this line, walk over to that wall, just normal. Okay, come back heel to toe. Fantastic. Now walk back towards the wall on your heels. And then come back to me on your toes. Okay, you feel okay doing that? You had a nice steady gait, that was fantastic. Go ahead and put your arms out for me. You can keep your feet where they are. Close your eyes. I'm just gonna watch and see how steady you are while you're balancing. Okay, looks good. No drift in your arms, no swaying, no falling over. Fantastic, you can open your eyes now. We're gonna do a slight little knee bend, okay? So if you can, balance on one foot and just do a little knee bend. This is just so we can check each knee individually, okay? Any pain or tenderness? I don't hear any cracking. That's good. Okay, I'm gonna have you turn around. I'm just gonna look at your back, okay? Go ahead, lean forward, okay? And assess your spine. It's nice and straight. You have any back problems?
No.
Any tenderness or anything? Okay, and stand up. Lean back for me just a little bit. Okay. Can you lean down towards your right side? And then towards your left side? Okay. And stand up straight and twist for me right at the waist. Okay, that looks good. If you're not having any pain or any tenderness, you can have a seat if you'd like. And if you don't have any other concerns for today, I'd be happy to answer any questions that you might have. No? Okay. You know what? You just reminded me. We have one more thing that we have to do. There's a rapid movement test, okay? So go ahead and put your hands like this. Flip them over. Fast as you can. Faster. Woohoo! All right. Sorry about that. Thank you so much for coming in today. We appreciate you being a patient here in our office. If you have any other health concerns, feel free to make another appointment and come back. Otherwise, we'll see you in a year for another physical.
Thank you so much.
Thank you. Have a great day.